The topic I chose to talk about today is panic disorder. I chose to talk about this topic because mental health is not talked about enough. There are many people that are scared to seek help for mental health disorders and end up taking their own lives. Panic disorders can happen when we overthink about we overthink something for or no reason at all. It can begin with getting dizzy, feeling tingly, sweaty, your heart's racing, you hyperventilate, you have this sense of impending doom, a fear of dying because you feel like you're going to go crazy. About 2.1 to 4.7% of individuals in the US suffer from panic disorders. In order to diagnose panic disorder, you must speak with your provider and explain the symptoms to them. You need to explain exactly what's going on, how often it's happening. Are there any stressful situations bringing it on? Did something drastic just happen that changed your entire life? You may also have to have an EKG done to rule out any heart conditions. You may have other physical tests done to rule out any other conditions before that. You will have to have a psychological evaluation. And panic disorder is actually more prevalent in women than it is in men. The percentage of women with panic disorder is 3.8%, and males are at 1.6%. The role of nature and nurture in panic disorder is panic disorder is mainly genetic. It's usually passed down to the children and grandchildren. Sometimes it does happen because there has been a situation in someone's life that has caused, that much stress, PTSD, things like that. Panic attacks, the treatment for them is usually psychotherapy, which is also known as talk therapy. It helps us understand and cope with the disorder. There are quite a few coping mechanisms, some holistic, some not, some traditional Western medicine. The holistic coping mechanisms would be meditation, yoga, lavender. You can take lavender pills. The Western medicine is, again, psychotherapy, SSRIs, citalopram, Paxil, alprazolam to take during an emergency when you can't diffuse the disorder diffuse the panic attack by yourself. Depending on the severity of the situation, they may do medication and psychotherapy together. Personally, medication has worked for me. It's done wonders. Psychology as a field, I feel, is very very beneficial to the well-being of individuals that suffer from mental health disorders, regardless of how small or big it may be. There's a lot of mental health providers that I feel over-medicate, and they don't take the time to understand the patient. I've also seen situations where the patient does need alprazolam or Celexis, but the providers are against giving it due to liability issues, which I do understand, but I think there are some situations that can be overlooked. And this course has affected my view of mental health issues and psychology by helping me understand that there's many different personalities out there. Not everyone you meet is going to be aware of all of the disorders or, all of the different little quirks of mental health, and they may meet someone and think that they're being rude to them, that they're not listening, not paying attention, when in reality that person may just be suffering from anxiety, some sort of social disorder, or even dissociative disorder that causes them to, disassociate themselves with the situation, with the person, with themselves in general. And again, I don't think it's talked about enough. I don't think enough people are aware of these situations, these disorders, and we definitely need to get it out there so it is okay. It is accepted more than it is now. I'll use the information that I've learned in this course. I'm going to apply it to my everyday life by realizing that there are a lot of mental health disorders that cause people to act shy, quiet, maybe even rude and mean. We never know what someone is going through, and we shouldn't judge them. We should just try to understand them the best we can. If they don't want to talk about what they're feeling, don't make them talk about their situation. As far as, the physical and psychological symptoms of panic disorder, they range. There's there's such a great range. It could be a sense of impending doom, tingling in your body, dizziness, numbness, palpitations, shortness of breath, shaking, fear of dying, insomnia, fear of not having control of your life in that moment, your body, your thinking, loss of appetite. It's just, there's so many other symptoms that, you know, send people to the emergency room many times a year, and it just turns out to be panic disorder. Again, benzodiazepines, selective serotonin reuptake inhibitors like Celexa, Paxil, fluoxetine, sessions with the psychiatrist, meditation. These are all things that can help the disorder.